There we go. This call is being recorded so that you are able to go back and reference it if we hit stuff that you need to hear again or had to step away from your desk for any reason. Also, if you have to miss any of the V3 calls, these are available to you on the website and also on our YouTube channel. So we appreciate everybody being here this morning. It's November 6th. This is the NEMSIS V3 implementation phone call. We've got a great group of participants today, and we welcome your feedback and comments. When you want to give some input, unmute your microphone and ask your question, or you can also use the chat feature, and both Bridget and I will be watching that and try and capture all those questions as you have them. So to start us off this morning, we've got Lisa Young, and Lisa's going to go over just a few minutes of some of the scheduled maintenance and other maintenance that we've had for IT. Lisa?
Great. Thanks, Julianne. Can you hear me okay?
I can.
Okay, excellent. Good morning, everyone. So I just wanted to, we've sent a few communications about this through the NEMSIS Google group as well as the DMC listserv. But the NEMSIS will be having an extended maintenance period on our IT systems. That starts next week on Monday at 4 p.m. Mountain Time. And the difference with this maintenance period is that we normally will send out a note and just remind you that some of our services may be up or down through Tuesday and Wednesday. This time, we're actually going to be turning off many of our services, namely the web service or the web submission service. So we will not be able to receive any submissions from Monday at 4 p.m. until sometime on Wednesday, and we'll send you a note when we're back up and running. Along with that, we will not be updating any of our dashboards or the analytical cubes, and most of our services will actually not be refreshed or even accessible externally until after we're finished with our maintenance. So I know that's kind of this is a big upgrade that we're doing on the back end, and I wanted to give everyone an opportunity to ask any questions or make any comments.
Hey, this is Jason with R1. So you said Monday at 4 p.m. Mountain Time is when you're starting?
That's correct.
Okay. It wasn't clear in the Google group email. It just said 4 Mountain Time, so I didn't know if that was AM or PM.
Oh, I apologize. We'll be more precise next time. Yeah, it's 4 p.m. So we're essentially, thanks for asking the question. We're essentially going to be turning off the web submissions because the way our process works, we have to clear out the queue, right? The queue of all the submissions before they get picked up by our ETL process. So we're basically just pausing things so that it can clear out by the next morning, and then the next morning is when we're going to start all of our maintenance activities.
Okay, thanks.
Sure. And Jason, we appreciate the partnership with R1, because on Wednesday, before we give the all clear to everyone that we're up and running, we'll be working with R1 to do some external testing to make sure that before we announce that we're able to accept data again, that has been confirmed to be up and functional.
Yeah, we're all set for that.
Great.
Thanks.
Thanks, Jason. Any other questions or comments, concerns? I think we have, I'm looking at the list here, we have representatives from most of the vendors here. ESO, Zoll, do we have Image Trend on the phone? Image Trend, are you there, Dan? Okay. So,
on.
Okay, thanks. All right. Okay, well, if you have any questions, if you have any issues, call me directly. Bridget can chat out my direct number. Bridget, can you put my cell phone, actually, just in case vendors want to chat before maintenance or during maintenance?
Definitely.
Okay, great, thank you. Okay, thanks, guys. Back to you, Julianne.
Thank you, Lisa.
Sure.
We'll go ahead and move on to Josh. Josh has a couple of discussion topics for us. And I will stop share so that you can pick that up if you'd like, Josh.
Okay, great. Thank you. Just a second here. Okay, is that working?
Looks good.
Okay. Hey, I have an update for you all on the Performance Measures API, which the NEMSIS TAC launched publicly in June. This was one that took years on and off of development and was finally released. So we do have some updates to the performance measures that I want to review with you. So again, we published this service in June based on the EMS Compass performance measures from that project. The successor to EMS Compass is NEMSQA, the National EMS Quality Alliance. And NEMSQA got together and actually re-specified or republished the EMS Compass performance measures in about August of this year. So they took measures that EMS Compass published, they looked at them, reviewed them, made some changes, and republished them under the NEMSQA umbrella. And those changes do affect the NEMSIS performance measure API. So I'm going to run through just kind of at a high level the changes, the measures that were changed and what we're going to do about them. So we have three measures that we've already implemented in the service. Seizure-01, blood glucose evaluation, was one of those measures. And that measure was actually retired by NEMSQA. The NEMSIS TAC has decided to continue to support that measure as it was originally defined by EMS Compass. So that measure will continue to be available in the web service. You can use it if you want. NEMSQA updated both of the other performance measures that have already been published in the web service. Those are Stroke-01, suspected stroke receiving pre-hospital stroke assessment, and Trauma-01, injured patients assessed for pain. The NEMSIS TAC plans to re-implement or update those measures to match the NEMSQA specifications. And the target for those re-implementations is January 1st, 2020. When that goes out, past data will be recalculated and will change. So in other words, if you were to get data for Trauma-01 sometime in December, looking back at 2019, 2018, 2017, if you were to make that same request sometime in January, looking at those same past dates, the data is going to be a little bit different. The numbers will change a little bit because we're going to recalculate all of the past data. So that's what we're going to do with the three measures that have already been published. NEMSQA also re-specified basically all of the other measures that we plan to implement. So these are the ones that are coming up next. Safety-01 and Safety-02, which are about the use of lights and sirens during response and during transport. Those measures have been developed using the NEMSQA specification, and those will be released in the web service in the coming weeks. After that, we will proceed through the other measures, and we're going to implement all of these according to the NEMSQA specifications throughout the year 2020. Basically, every 2 months or so, we'll release a new measure. So at that point, then all of the measures in the performance measure service will use the NEMSQA definitions, not the EMS Compass definitions. There was one measure that we planned to implement that NEMSQA has retired, and that's Trauma-02, pain reassessment of injured patients. And so we will not implement that measure. Okay, any questions on what I covered, what we're implementing in the performance measure service, and the changes that are happening?
Where do we get those specifications, Josh?
Great, I was going to wrap up with that, so thanks for the question. There's two places. The technical specs are in the technical resources menu on the web services page. I'll show you that in a sec. And then public reports has a dashboard for the performance measures that is intended for end users. So let's go to here. So for software vendors who want to implement something that uses the web service, go to the technical resources and then web services, and then scroll down to the bottom and you'll find the performance measures API, technical guide, measure definitions, etc., and the WSDL. For end users who want to see the data through a product that NEMSIS provides, they can go to the public reports page and go to version 3 dashboards and follow the link to the performance measure dashboard right here. That'll give them that the visual of the data. And again, these numbers will change slightly when we re-implement with the NEMSQA specifications. I don't anticipate large changes to these numbers, but they will shift a little. Any concerns about the re-implementation, the fact that we're going to be recalculating the past data on these measures, that past results will change? Okay, but we feel like we're still pretty early in the life of this product, and we know that vendors are going to be super busy implementing NEMSIS 3.5 while we continue to put out additional performance measures here. But long term, NEMSQA has signaled that they will do annual reviews of their performance measures. So any given performance measure could be respecified every year. I doubt that'll happen to every measure. I'm sure they'll stabilize over time. But every year there is a chance that some of the measures will be adjusted by NEMSQA. And so we'll be looking at a process by which we can make that predictable and understandable as to what sorts of changes may be made on an annual basis. Okay, any other questions on the performance measures service?
Hi, this is Amber. Is there any way you could just put a link to the NEMSQA materials on the NEMSIS website?
Yeah, let me go back. I'll show you what we're going to update. So if you go to the performance measure dashboard user guide, it talks about the dashboard, but it has a link here to the V3 performance measures. And it lists each measure that we've implemented so far as it was defined by EMS Compass. So we'll be updating this documentation page here, and we will be providing links to the NEMSQA definitions for each of these measures.
Great, thanks.
Mm-hmm. Okay, great. Let's see, Julianne, I guess, should I move on to my next, I think I have the next topic.
You do, go right ahead.
Okay. I am filling in for Laurel, who is out of the office this week at a training that she's attending. But she asked that I just give you a kind of a reminder of what she's working on to address some bugs that were discovered in the release of NEMSIS 3.5.0. I want to show you where you can track those bugs. So if you click on the V3 release timeline from the NEMSIS homepage, then follow the breadcrumb trail back up here to the NEMSIS 3.5.0 revision. And one of the buttons here is how can I follow along? And finally, the NEMSIS public JIRA project. So if you didn't get lost, there we go. These are the bugs that have been reported so far in the NEMSIS 3.5.0 release that came out on September 30th. There is going to be a critical patch release that will resolve these bugs. There will be no feature changes. Those have all been locked. So this is only a release to address technical bugs that have been found in the standard. So you see about a dozen of them here. Some of them only affect things from like a data dictionary perspective, but there are a few that are actually going to be changes to the structure of the XSD. For example, there were some data elements where correlation IDs were on the wrong element. They needed to be on the group, and instead they were on a child element within the group. That's an XSD change. Other things, though, are just really data dictionary only. So the NEMSIS staff considered how best to publish the updates with these bug fixes. Given staff time and resource constraints, the NEMSIS TAC is going to stick with doing a release around November 30th, December 1st. That will be the critical patch release that will contain the bug fixes for all of these issues in one release. So look forward to another, a 3.5.0 dot something CP1, critical patch 1, that'll come out November 30th to December 1st, right in there. If you are developing and run into something that you think is a bug in the 350 standard, we strongly encourage you to contact the NEMSIS TAC to discuss that potential bug and make sure that it is something that they either are aware of and plan to fix in that critical patch, or else, if it's not a bug, they can help you understand how it works and why it was designed that way. We really want to make sure that any additional bugs that may be out there can all get fixed in this one release. Okay, so again, filling in for Laurel there, but any questions that I might be able to field on the 350 critical patch? Okay, well, thank you. Back to you, Julianne.
Okay, thank you. I'm going to go ahead and take the screen. All right, we're going to talk just for a minute about some of the initial products to Socialize v3.5. I'm going to pull up, let's pull up some of these. Start with harmonization of cares. So I'm just going to briefly show 5 of these info sheets that we've developed that are ready to go to the DMC for some final input before they are pushed out to the general public and on the website. So these will be, we'll hit these, we'll discuss these a little bit on the DMC call next week, but I just want to show them, and some of these you've seen before as we're developing, and we just want to make sure that we've got the consistency and that we're hitting the right language and description for the audience. So this first one here, harmonizing NEMSIS with CARES, we worked with CARES and making sure that the information available was accurate and that it was at a level of accessibility for even frontline clinicians, so that we weren't getting too technical. So that one will go through harmonization of NEMSIS and CARES in 3.5. Errors and warnings, that's the back page. So we've got errors and warnings. There's the back page to it. Patient and incident disposition. This was a pretty significant change for 3.5, adjusting e-disposition 12. This is one that you guys have seen before, and it will roll out with the other products as well. Pertinent negatives and not values. So we tried to keep this one from getting too technical. Especially for the nillable fields, the use cases for some of these are software based, and so our frontline clinicians aren't going to experience any of these, but we wanted to make sure that the definitions were clear. We had some good feedback on adjusting some of the ways that we described things. So that one's coming through. That's the back page to that one with just some examples of pertinent negatives and not values. I know I'm going through these pretty fast, but we'll send out the PDFs and we really, truly welcome your feedback, comments, how to make these products that really address your needs. And then UUID, that's another one that is internal to the software, but we wanted to make sure that we described that well enough because it was a change from 3.4 to 3.5. And those are different elements that have the UUID. So we've got others in the hopper, but if there's specific ones, specific topics that you would like addressed in some tools to be able to socialize to your stakeholders, we are happy for those suggestions. We have several more on the list that we'll continue to work on these and also run them through the DMC so that we can get the data managers' feedback on just tightening these up so that they're really accessible and usable in the field. Any questions on the products to socialize 3.5? We're also working with the DMC on their extended data dictionary, so that will be updated as well for 3.5. And I know that we've had lots of feedback on how helpful the extended data dictionary is for describing some of those different data elements. All right, so we'll just go into the next topic, which is NEMSIS plans. We want to be able to stabilize some of the elements utilizing the national coding schemes. This includes, let me pull up the website. So this includes ICD-10, RX norms, SNOMED. We want to be able to tighten up those suggested lists to provide some standardization. You can access those through the NEMSIS homepage, technical resources, and then resources. These suggested lists and other resources are in the process of being updated. So a lot of the Excel spreadsheets have been updated. The white papers, which are in this column, are in the process. So if you open one and it's the previous white paper, it just hasn't been updated yet. But the data elements that are affected by these national coding schemes, cause of injury, e-injury 01, e-medications 03, we're combining primary and other associated symptoms. So this won't be two options. There'll be a combined white paper to explain that process, and then a combined Excel spreadsheet with those lists. E-situation 11 and 12 for impression, that's updated. And then we've got e-procedures as well. Let's open up, let's look at symptoms. So if I come over here, I can click Excel, and it's going to download the spreadsheet for that. And here you can see we've got, well, let's do this route. So we're into e-situation 9 and 10, primary and other associated symptoms. The national coding scheme for this is ICD-10, and the idea is to capture the most commonly used descriptions and codes from the field. And for this list, we have 26 million records that we reviewed for frequency, and we're able to capture 90% of the primary and other associated symptoms in this list. The idea here is that as we have symptoms that are a little bit more specific, some agencies get really very specific with their ICD-10 codes. We want to be able to establish a good roll-up system so that as they get super specific, there's a natural flow for them to roll up into a code that's more of a parent code, a grouping code. So we'd like to keep it in the ICD-10. We'd like to keep it to 3 to 4 digits. Sometimes you have to go into that fourth digit. Occasionally, you've got to see that next digit, and then very rarely, I'm going to show you this one down here as an example, we go into that sixth digit. There is no other ICD-10 code that gives us the specificity for suicidal ideation. And so we have to go with that longer code, but everywhere else, if it can be rolled up and still stay pertinent to the EMS activation, then we'd like to encourage that standardization of these descriptions. So we've got here, you can see the counts. This is just to show how what the count, what the frequency was, and how we came up with, if you come all the way down here, you can see that we've hit 90.389, and the number is probably actually a little bit higher than that, as some of these naturally roll up into some of these higher parent codes. So we will be doing some adjusting on these. We want to make sure that they truly apply and capture that large majority of the codes that need to be used. But we recognize that there always will be there will always be that one-off. There will always be that 10% that just don't fit or just don't have a natural roll-up. And especially if you have unique situations for your regions or areas that you're tracking specific things. You know, there's still going to be that room for that customization at a local level for what you need. But we want to be able to capture and reflect the bulk, the majority of what is being seen and what's being documented for this national standard. I'm going to stop talking for a minute and let you guys weigh in if there's any questions on those.
Is that 90% across all regions? Is there any kind of regional consideration?
No, it is purely national aggregation. So there's, you know, there's certainly room for some regional adjustments where you just see some different things depending on your locality that don't occur on a national scale frequently enough to be included in the 90%, but for a local issue, it is in your 90%. All right, sounds good. I don't believe we have any items right now from the Office of EMS NEMSQA. If I'm mistaken, somebody can jump in real quick. I know there's a lot of conferences and trainings happening this week, so we've got people out of the office for that. Are there any issues or questions, concerns that any of you would like to bring up during this time, during an open forum option?
Topics in general, topics related to this last piece of the agenda.
That's a good question, Brian. Well, you've got Josh still on the line. You've got some other. You've got a good audience. So if there's specific questions, even if it doesn't deal with the agenda items, if we can't appropriately address them now, we can certainly put them on a future agenda.
Right. Yeah. I wanted to make sure I wasn't getting ahead of the open forum at item 8.
Go for it. It is open forum.
Neat. Okay. So first one's kind of easy. I think CMS in 2020 is going to start accepting non-PCS
PCSs, non-physician certification statements, as physician certification statements for unscheduled and non-repetitive transports. They've released some guidelines on the roles of people that are able to sign those. And I wondered if e-payment, oh, it's 15. Now I'm gonna, hold on. Oh, I got it right here. Not 15, that's crazy. E-payment 5 would potentially be tagged for an update to allow for the capturing of those new roles that are now able to sign the CMS non-PCS PCS.
That's a really good question. We want to be able to stay flexible enough to be able to address those changes. So you said that was e-payment 05?
Yeah, e-payment 05 is the healthcare provider type signing, and it has a nice list. It's been consistent across the versions of the level of healthcare provider that's been needed to sign these documents in the past. And with the new rule, there's going to be a few new roles that aren't necessarily healthcare providers, or maybe they are. But you know, just like I know we have a flow of like consider the addition of fields, things like that. I don't think it's not a bug or anything else like that. Just, you know, here's something we can consider in our flow of, you know, is this field holding these values the right way, and should we be adding more to it given CMS's new rules?
Absolutely. Let me follow up on that, and I'll pull up that CMS 2020 so that we can make sure that we've got a good list of those other definitions. And then let's add that. I'm going to add that to the agenda for the next call so that we make sure we follow up on that.
Cool. And then I had one other thing that may be a little bit bigger of a question. So recently we've seen some states are moving in the direction of requiring NEMSIS certification within a certain calendar time. So certified within the last 12 months, certified within the last 24. I just wondered if the NEMSIS TAC has a position on whether or not certification as a NEMSIS receive and process or collect system has an expiration date, doesn't have an expiration date. This is something that's left up to each individual state. I only ask because as NEMSIS is the only organization able to certify, certainly if all 50 states decide that they want 50 different tenures of certification, our testing with you guys is going to go through the roof.
Right. Josh, are you still on the line?
Yeah, Laurel is working on some changes to the compliance requirements, certification requirements. And I know that one of the topics that she's working on is essentially that question of how long does certification last? And I believe that she's looking at a 2-year time frame that vendors that have been certified compliant would need to come back within 2 years for a retesting process to maintain that certification. We do know that there are some states, or at least one state, that is asking vendors to actually go through the process annually, and the NEMSIS TAC will support that. We'll be moving to a process of using new test cases every year, so that there's something, you know, so you're not just putting in the same test case that you put in the year before. But I think that at the national level, she's looking at that 2-year time frame. Any thoughts or feedback on that?
Who's looking at annually?
I know that California looks at wanting it annually. I'm not sure about other states.
From my understanding, they were biannually every other year.
Oh, okay. Well, and that, like I said, that's what Laurel's looking at doing at the national level is a biannual.
Okay. Just want to make sure I wasn't
Would-
missing somebody else.
California's looking at an annual right now. Some
Annual,
vendors haven't
yeah.
tested since 2016.
So, does anybody have a source on that? So last time I talked to Mark, he was looking
Yeah.
at everybody needed to be within 24 months.
That
No,
was
it's
Mark.
12 months.
12 months? I'll have to talk to him again.
He has changed
Yeah,
his
feel
mind.
free to give me a call. I'll be back in my office later this afternoon if you got a question.
Sure.
On the annual testing with the new cases, is that a different test for each of the 3 versions?
For 2 versions, 3.40 and 3.50. So testing for 3.34 will be discontinued, is my understanding. I know that we're continuing to accept 3.34 data for a while longer, but my understanding is that there won't be any testing going on 3.34. Now that could throw things a little bit, I guess, in a state that wants annual or biannual testing and still accepts 3.34. We might have a bit of an issue there, so maybe we need to discuss that, the NEMSIS TAC.
Do you guys feel ready for 55 test cases per year, every year?
Yeah, that's a good question for Laurel.
I got one product with 2 versions that has to test on 2 versions, so I got to do it 2 times a year, and so does every other vendor. That means
Yeah.
you guys have to do it 2 times however many vendors there are. My concern is not for my guys to be able to work with you and send test cases back and forth. My concern is you're talking about 4 to 6 a month, whereas before you might have been doing 4 to 6 a year.
Right. Yeah. No, it's good feedback, and Laurel would be the best one to respond to that. So I'll kind of defer till she's back on and can address that.
Don't tell her about it until she actually gets back.
Okay.
I would like to, this is Mark Roberts from California. I would like to just say that we put this requirement out in July, that people needed to be testing and that we would be verifying. We have 22 or 24 vendors in California that are reporting data right now. And this is strictly in order to be able to get some continuity. We're finding a lot of errors, a ton of errors, mostly schematron errors, some schema errors. And so in looking at the years when they last tested and the versions that they're submitting, they're not even close. We got one that's submitting a version 4 alpha, but on the website they're saying they tested for version 1.0. So that's why we're trying to get this cleaned up.
Yeah, no, totally get it, and believe me, I'm a big believer in good data and being able to pass through schematron. I think the concern that I had was unless there's something from the TAC, then if each state's able to write their own requirements, the only body that's able to certify things then doesn't have a say in how long a certification is good for, what qualifies as a version that needs to change. So, to the point that I was on version, I'm now on version 4 and I tested on version 1. If I made that jump within the last 4 months, would I have to recertify? And if so, who says I have to? Does California say I have to certify at the national level, or does NEMSIS say I have to certify at the national level?
Well,
Because
so
who's to say that
we talked
Hawaii
about
doesn't come back? Hold on. Who's to say North Dakota doesn't come back and say, well, version numbers don't change. We want a recertification on every subversion number. So when you go from 4.1 to 4.2, you have to recertify with the TAC. So if the states are dictating how long a certification is qualified for at the NEMSIS level, the NEMSIS is going to have to prepare itself for testing products constantly every day of the year for the rest of the time, because that's all they're going to be doing.
They're in charge of the standard. I mean, I guess the other option is that the state just implements its own testing process, and so now you have to pass the national and then you have to pass the state. I don't think that's any good for anybody either.
I totally agree.
So that's kind of where we're at. Open for discussions, but I think also the NEMSIS TAC, when we talked about it, they said minor revisions. There is a section in there versus minor revisions versus major revisions. And maybe that needs to be better defined too. I mean, the lucky part of it is that pretty much anybody that tests right now for version 3.4, you're done, because then you're going to turn around and test for version 3.5. So you're golden on both versions. So anyway, I got to run. Good luck with this, everybody. And I'm open for discussions if anybody wants to give me a call.
Thank you, Mark. Thanks for clearing up some of those issues with California. We appreciate that.
You absolutely. Take care.
So we'll have Laurel follow up on some of this discussion as well. I know that that's been a huge issue on her plate, and we appreciate that conversation. And Ryan, those are really good, pertinent questions that you've brought up that we need to make sure gets addressed. Is there anything else on those topics or other topics that anyone wants to bring forward at this time? All right, so we've made some adjustments for the holiday season for the upcoming meetings just in November and December. Next meeting will be November 20th, and then December 4th and December 18th. Those just have shifted to the first and third Wednesdays instead of the second and fourth. And we'll go back to second and fourth Wednesdays in January. All right, as always, please feel free to reach out to any of us at the TAC with your questions or concerns. Any input or feedback is always welcome. Thank you for taking time out of your busy schedules to be with us this morning. And I'll go ahead and end today's phone call. Thank you all for being here.